SLE or lupus is the acronym for an autoimmune disease called systemic lupus erythematosus. Lupus is caused by some faults in our immune system. The immune system, which is well equipped to fight bacteria and viruses that enter our body, turns on us and attacks our healthy cells. In short, it is like fence itself eating the crop. On this World Lupus Day that is observed on every May 10th, Dr. Glaxon Alex, consultant rheumatologist of SUT Hospital, Pattom, speaks to us about the disease, symptom, diagnosis and treatment. Lupus is considered an important example of an autoimmune disease. The disease can affect our skin, joints, lungs, brain, eyes, nerves and many other organs. Therefore, it is not a trivial disease. Awareness about this disease is still very little among the people. Although lupus was once considered a rare disease, it is now estimated that about 40,000 people are affected in our small state Kerala itself. The disease affects very young children and the elderly, but is most commonly found in women between the ages of 15 and 45. The female-male sex ratio of the deceased is 9:1. Now, what causes lupus? Studies show that it is caused by the sun's ultraviolet B rays, the estrogen hormone in women and some genetic factors, according to the doctor. What are the symptoms of the lupus? Because lupus can affect any organ, the symptoms vary from patient to patient. In the early stages of the disease, red photosensitive spots on the skin or red spots on the cheeks, known as butterfly rash, may be seen. Some people may experience frequent mouth sores or joint pain and swelling. Others, however, may have chronic fever, extreme tiredness or alopecia areata in the initial stages. If the disease is not diagnosed and treated properly at this time, it can seriously damage the internal organs and become life-threatening. Lupus mainly affects the kidneys, lungs, brain and nerves. Because of this diversity of symptoms, patients see doctors only at an advanced stage for proper diagnosis. This is why lupus is medically referred to as the great mimicker. According to Dr. Glaxon Alex, diagnosis of SLE is not possible with a single test. In the early stages, the ESR will be very high. Sometimes the levels of hemoglobin, white blood cells and red blood cells are low. Some other tests may be needed depending on the organ affected by the lupus. For example, a protein leak in a urine test and scans of the lungs and brain may be needed for diagnosis. People with any of the above symptoms should see a rheumatologist early on because of these complications in diagnosis. The primary duty of a rheumatologist is to determine at an early stage which organs are affected by lupus. ANA or anti-nuclear antibody testing is the mainstay of the diagnosis. When it is done by immunofluorescence method, it comes out as positive in 99% of patients. But not everyone who is ANA positive will have lupus. In short, symptoms, clinical examinations and other blood tests may be necessary for a proper diagnosis. Now, can the disease be treated? The doctor says the key to SLE treatment is to bring the immune system back to normal with medication. Until 2 decades ago, people relied heavily on steroids, but now with advances in rheumatology and immunology, steroid use has dropped significantly. Which drug to give depends on which organs are affected and the severity of the disease. Increasing or decreasing the dosage of medication should be as directed by the rheumatologist. In patients with SLE, the disease may worsen during pregnancy and postpartum. But with the new immunomodulator treatment, the disease can be completely controlled, making it possible for lupus patients to become pregnant just like normal women. It is also possible to breastfeed with safe medications. Now, here are some tips from the doctor for lupus patients. The patients should protect the skin from sunlight, that is ultraviolet B rays. Take medication only as directed by rheumatologist. Inform the doctor in advance if the patient is pregnant or intends to conceive. Patients should not discontinue medication or self-medicate without consulting a doctor.